All right, everyone. I think we waited a decent amount for people to kind of get logged on. So we'll go ahead and get started. Yep.
I was waving hi to you,
Oh,
Karen.
hi there. So we're gonna go ahead and we'll get started. If anyone has not opened up their quiz yet, that is a code to open up the quiz if you're looking to get um, the completion certificate at the end of this. Is everyone able to hear me okay? Okay, and you guys are able to see my screen? Sounds good. So today's really going to be a little bit different than what you guys have had in the past in terms of the format. I know you guys are probably used to having like a case that people go through and then writing up like a sample note and learning a little bit more about the case itself. Today I'll be really kind of be talking generally about general surgery and the specialty itself, how to get there, and kind of like what the day-to-day life of a general surgeon looks like. Feel free to interrupt me at any point throughout the presentation. If you have questions, ask them right away. I do not mind at all. So just start off, we'll just to see where everyone's at. We will start with a poll. Just give me 1 second. All right. So majority flying in the future pre-med. Nice, nice. Okay. So this will be a nice overview for you guys. Again, if you have any questions whatsoever as we go through this, or even just questions in general, definitely go ahead and interrupt me. So just something really quick, quick introduction for myself. My name is Karan. I am a DO, graduated from Toro College of Osteopathic Medicine in Middletown, New York. Currently, finished my clinical years of general surgery residency to year 2, and I'm on a research year right now between years 2 and 3. I actually originally was joined up with Motivate MD back in 2021, and then took a hiatus, and I'm now back working with them on their med school and the residency teams. So just a general question. Anyone know or have an idea of what a general surgeon is or what a general surgeon does? Go ahead and you can put it in the chat as well. So overall, if you were to just kind of look up the generic definition for a general surgeon, this is kind of what you would get out of a dictionary or from Google. If you read through this, you can see it's a wide variety of multiple different aspects of medicine, being a doctor, and then treating a patient, everything from what you would expect, like anatomy and physiology, to things like pathology, wound healing, and even taking care of patients that are in the ICUs. Generally, when you're talking about the specialty of general surgeon, you talk about 9 different components. What I mean by components is basically different areas of the body that a true general surgeon would be able to treat and kind of diagnose. Um, so there is a shift, or there has been quite a bit of a shift between the specialty of general surgery. If you take a look at this list, it's a lot of everything from head to toe, obviously excluding the stuff that's in bold. But apart from that, most of the major surgical conditions that you think of or could think of could be treated by just a general surgeon. And that was the case originally when the specialty obviously first started off. It was one surgeon for every few hospitals who need to be able to take care of everything. Even now, in some very rural areas, you will have a general surgeon who is still trained up on how to do all of these different components that you see here. However, now with more and more fellowships and training after residency coming about, a lot of these different components have been more specialized. But you can see it's everything from the GI tract in the abdomen, head and neck. Vascular surgery is also a training branch that comes off from general surgery, and is now becoming a little bit more common. And so there are some direct residencies into those programs as well. However, it's vasculature, excluding everything from the brain as well as the heart. And then endocrine surgery, we general surgeons are trained on how to do thyroidectomies and deal with the endocrine system, surgical oncology as well, and then trauma and critical care as well. So in general, I tell people it's basically everything except for your cardio, ortho, and your neuro when you think of surgery, at least. So the different work environments. You may think that because I'm trained to be a general surgeon that I just work in the OR or even just in a hospital setting, but that's not the full picture of the career of a general surgeon. As you can imagine, yes, you do need to have an operating room to be able to do what you are trained to do, which is to operate. And so that would or would not be connected to a big hospital setting. However, a large portion of the time that's spent for general surgeons is typically spent in their clinics. Um, so seeing patients before they're diagnosed with the surgical problem, following up on patients that have just had surgery, and in some cases, things like bariatric surgery, having full weight loss clinics that would follow up with patients and into the event of that they would need a type of surgery. So your working environment really does change. Typically, surgeons, once they are full attendings, have certain days that they operate, and then the rest of those days they're in the clinic. Um, and then there are types of surgery and specialties within general surgery that you can complete all of your surgical procedures in an outpatient setting, meaning like a 1 day surgery where the patient wouldn't need to be admitted to the hospital at all. So the daily life of a surgeon, if anyone's seen the show Grey's Anatomy, this is a horrible way to explain what the daily life of a surgeon is. So I've kind of split it up into two different areas because for those of you, since most of you guys are potentially going to be applying in the future, one of the things that's kind of down the road for you guys would be figuring out how do I know what specialty I want to do? And why. And a lot of that comes down to what you think your daily life is going to look like, not only as a resident, but also up into your life as an attending. And this is kind of a very brief breakdown of that. Um, I would say the numbers here are all going to be different depending upon what kind of program you're at and things like that. But in general, you can expect if you go into general surgery for medical school, you'll be getting up almost every day at 5 just to look at your patients on the computer and to pre-round on them. And then some programs are earlier, some aren't. But for the next 3 hours, you'd be at work seeing patients and then calling the attendings for plans. And then really around 7:30 and onwards, you're going to be in the OR operating, or you'll be taking care of patients who are on the floors. And then about 6:37, you probably will be able to go home. And then there are tests that you have to take in residency. There are tests that you have to take as you're attending, and so it is a constant studying profession. And so you do a lot of times go home and you have to study for a bit before you're done for your day. Um, Everyone talks about the 24-hour call, and a lot of people will say that the life of a surgical resident isn't the greatest. But this is kind of like the general aspect of it. It goes by very quickly for me. And then there are days where you do have to do 24-hour shifts here and there. It just really depends on where you are in the country and how your program is really set up. Some programs will do them every 4 or 5 days, and some other programs will only do them on the weekends. Now, when you come in attending, so after you finish your residency life and you're working on your own or in a practice, schedule kind of changes a little bit. Like I mentioned, you do have days where you are operating, and then you do have days where you're solely in the clinic. And those can vary depending upon what is scheduled, what cases are going. So it could be late into the night, or it could just be normal business hours. Um, and then typically for most areas of where you work, if you are on call as an attending, it's typically from home, except for if you do a specialty like trauma critical care. Those attendings are typically in-house in the hospital at all times. So what patient population do I take care of as a resident? Everyone. You'll be working in a hospital setting. So anyone who comes through that door is someone that you will treat. As a general surgeon in generally, you are able to treat whatever patient there is. However, if you do something more specialized like pediatric surgery, that is something that is like a specialty within itself after you complete your general surgery training. Um, and then you can have different populations of patients based off of your specialty within surgery. So things like vascular surgery, breast surgery, surgical oncology, all those are specialties that you have to first complete a general surgery residency that you can then get into and be eligible for. So this is the question that everyone kind of asks or is curious about is how long it took me to get where I was. This is a general outline of the residency and the timeline for the specialty itself. So obviously you have your basic 4 years of med school, 4 years of college before that. The residency timeline is really where it changes a little bit. It could be 5 years. However, it could be an additional 1 to 2 years based off of where you are and what kind of setting you're practicing in terms of is your hospital a big university hospital that does a lot of research and has a big surgical program, or is it more of a community hospital, in which case the research aspect does not need to be any dedicated years. In general, it's about 1 to 2 years that people do take off from clinical duties, meaning you're no longer practicing as a general surgeon or as a general surgical resident, unless you're in the hospital for a call shift, in which case that means you're solely using your time for research, and that can be bench research in a college or in a university setting, or it could just be looking at things like what we call as outcomes research, with the use of like previous data that has been collected. And for most people who do go through general surgery residency, they do end up going on and doing a fellowship, which is like that specialization that I was talking about earlier. You can specialize in a bunch of things, which is a presentation all on its own. However, in general, I would say like the average amount of years of fellowship is anywhere from 1 to 3. One is something like minimally invasive surgery or bariatric surgery, and then something that has maybe 3 years would be something like surgical oncology or transplant surgery. So my path, I took 5 years of college. I did a double major in biology and psychology. After that, I did a year of grad school before starting med school. So that's 5 years total if I add that to my med school. And then for my residency, I do have 5 clinical years, like I mentioned. That's the bare minimum for all general surgeons in terms of their residency training. And then my program has a 1 year research year, which is what I'm currently on right now. And then we'll see, hopefully trying to plan for a minimally invasive surgical specialty and take it from there. So do you have the chat is open, and feel free to unmute your mics as well. Does anyone have any questions about general surgery and the residency, the training? Any questions about my day-to-day experiences so far? You can go ahead and either place them in the chat or you can go ahead and ask.
What's your day in the life as a general surgeon for you? Like, can you tell me more about your day in the life and what's it like?
Sure. So for me particularly, because I'm a resident, I do go in quite early in the mornings, like I mentioned. When we do our rounds and pre-rounds, it's basically our time to figure out what's been going on with the patients from the night before. And then so that we're the most caught up to date with how they're doing. So when we go and see them, we can kind of accurately give information to our attending. So I'm typically there like around 4:30, 5 o'clock in the mornings. Um, Depending on your year of research, depends on how much you're actually operating in terms of complexity of cases. So for me, as a second year now going into my research year, I would have days where I would be rushing to finish my rounds and speak to attendings, and then just kind of running straight to the OR to get my cases started. Um, and then you don't leave for the day for the most part until your surgeries are over. So if there's delays in the OR, if there's delays because patients are late for their cases, um, you're really there until the end to see everything through. And then obviously making sure that those patients you operated on are still doing well. So I would say like a total, if you look at my day, it probably starts anywhere from like 4:35, and on a good day could end at 6. On a bad day could end at like 10:30 at night.
Yes. Thank you.
Yep. There's a question. What did you do with the 1 year of grad school? So I actually it was a special master's program before I started medical school. So it was a 1 year program where it was basically the first year of medical school courses. And I was able to secure a spot into medical school with that degree. Are there any other questions? All right. Well, if there are no other questions, I'll stick around in case anyone does have anything that they want to ask. Here's some just quick info about some of the future topics that are coming up for the virtual shadowing. And then again, don't forget to submit your quiz if you are looking to get the completion form. As I mentioned, I'll stick around if there is anyone that has any other questions. I am more than happy to ask them.
Sorry, Karen, are you still there?
Yep, I'm here.
Oh, okay. I thought for a minute I thought you disappeared. I'm like, what? So let me ask you one last question. I know you have to go, but
Oh,
what what was it? Oh yeah. What was your major back then at your university? And do you have any advice you want to give out for pre-med students, like if they want to apply for the thing that you're doing, like pursuing in the field of general surgery and all that stuff?
yeah, so in college, I did a biology and a psychology double major. And then for my grad school, the degree is a very long degree, just it's interdisciplinary biological and physiological sciences. So it's mainly the basic biology classes as well as pharmacology classes. Um, and then I forgot your second part. Advice
Yeah,
on the program and like the master's program I did, or advice on getting like doing general surgery.
kind of like general surgery and whatever type of advice you want to give out.
Yeah. So I would say, I mean, if you're looking to go into a specialty like the
Mm,
surgical specialty, um, it's definitely something that you need to consider highly in terms of what you see your life like in the future. It is cool to say that you want to do surgery, and it's a very fulfilling career. But it does take a lot out of your personal life. So it is a lot of time spent training and doing things like that. And when you're working and operating, you never know when there's going to be something that comes up. And so, you never really can have a hard set time of when you're going to be going home for the day.
nice, nice. Well, Cotton, thank you very, very much. I really appreciate it. It was a great and very quick section today.
Yeah, no worries. It was a pleasure meeting you.
Of course.